This may be the most important video you ever see because it could be the difference between becoming another heartbreaking social media post, another woman crying out for help, confused, dismissed until it's just part of getting older, or becoming one of the women who takes her power back. The woman who feels vibrant again, sleeping deeply, thinking clearly, loving passionately, living like she's 30 again. Hi, I'm Dr. Tammy, and for over 25 years, I've been helping women do exactly that. Because the truth is, you're not crazy, you're not broken, and you're definitely not alone. What you're feeling has a cause, and more importantly, it has a solution. So take a deep breath, turn off the noise, and give me just a few minutes. What you're about to learn could change everything. If you're struggling with exhaustion, brain fog, weight gain, or mood swings, there's a very real reason. Your hormones are talking to you. And until now, no one's been listening. And no, it's not just stress or part of getting older. If you've ever felt dismissed at a doctor's office, you know the drill. You explain the fatigue, the irritability, the hot flashes, or the fact that you can't sleep through the night anymore. And the answer? A shrug, a prescription, or worse, that's just what happens at your age. But let's be honest, that doesn't make the 3 a.m. wake ups any easier, drenched in sweat. It doesn't explain why you've gained weight, even though you're not doing anything different and your diet has not changed. It doesn't give you back your energy, your patience, or your spark. And the scariest thought of all, that maybe this is just how life will be from now on. But here's what I want you to know. There are reasons for your symptoms and there are answers, and you're not losing your mind. What you're experiencing has a name. It's hormone imbalance or hormone depletion. And once you see the real picture of what's happening inside your body, everything makes sense. Why do most doctors miss it? Because traditional medicine is great at treating emergencies or acute care. But when it comes to subtle chronic issues like hormone imbalance or hormone depletion, too often women are dismissed. Symptoms are brushed off, tests aren't run, and the same two words come up again and again. It's just stress, you're just tired, you're just depressed, or here's a pill for that. But hormone health isn't guesswork, it's measurable, trackable, and fixable. You just need the right tools and someone who knows how to use them. And that's why I created the Symptom Scan Analyzer. It's my proprietary assessment program, and it takes 6 key areas of your hormone health and it reveals the patterns behind your symptoms. And in just a few minutes, it gives us a clear clinical snapshot of what's happening inside your body. So your next step starts today. You don't have to keep wondering what's wrong. You don't have to keep hearing it's just part of aging. And with one simple call, you'll finally have the answers. You'll know what's happening inside your body. We'll go over your symptom scan analyzer, actually be able to dose bioidentical hormones right away and get you in a plan with our hormone coaching and all the benefits of being in our Hormone Plus membership. Because you deserve a team that will listen, you deserve clarity, and most of all, you deserve to feel like you, the best version of you. Did you know that there are over 30 symptoms of menopause and that hot flashes and night sweats are just a few of them? And they're just the tip of the iceberg. A lot in commercial medicine want you to believe that it's just hot flashes and night sweats so that you'll think everything else has a medical diagnosis for it or that there's a drug for that. But I'm telling you, of all these symptoms, menopause is at the root of that, and it can be fixed with hormone therapy. Just that easy. You can also have things like irregular periods, loss of libido, vaginal dryness, fatigue, hair loss, thinning, sleeplessness, difficulty concentrating, frozen shoulder, fibromyalgia, dizziness, weight gain, heart palpitations, incontinence, bloating, low libido, mood changes, anxiety, depression, not sleeping, exhaustion, brain fog, and that's just to name a few. So, what if everything you thought you knew about hormones was wrong? What if asking one simple question could change your life? And when you start asking questions that are uncomfortable to commercial medical providers, the truth becomes undeniable and the myths fall apart. The agenda is exposed and healing can finally begin for you. I want to tell you that I was a doctor, but I didn't feel like myself. And I have struggled with so many of the issues that a lot of women struggle with. I was exhausted. I had every hormone problem you can name: PCOS, cervical dysplasia, endometriosis. I had fibroids, dysfunctional uterine bleeding, even struggled with infertility for over 13 years, had a tubal ligation, a C-section, an ovarian tumor, and a hysterectomy. And on top of that, I had autoimmune thyroid, insulin resistance, and adrenal insufficiency. So I'm not trying to one-up you on any of this. I'm just trying to say I do understand. And I've helped tens of thousands of women over the past 25 years with perimenopause, menopause, and every other hormone and functional medicine issue you can name to get their life back. So I want you to understand that hormone decline and depletion is really a bigger problem than just the term menopause. Because what happens is around the age of 45, our hormone levels, our estrogen and progesterone mainly, start to, just like a roller coaster, just completely plummet. And then when our ovaries have completely run out of eggs, which is what menopause is, and the reason we stop having periods is because our ovaries have no need to function or make hormones anymore. Now we deal with hormone depletion syndrome. So I want you to know that there are differences in hormones just out of the gate so that you can start to understand that our program uses all natural hormones and we don't use synthetic hormones. Think of it like a strawberry or a strawberry candy. They're very, very different. The benefits of restoring hormones can help with your memory, your mental clarity, your energy, motivation, can help balance your cholesterol, metabolism, mood stability, get you deep, restful sleep, can help with your libido and sexual wellness, can help with pain and joint discomfort. And what's better is it can decrease your risk of diabetes, actually decrease your breast cancer risk when you use bioidentical all-natural hormones and get them balanced. It can help with UTIs and bladder issues, chronic inflammation, heart disease risk, and so much more. I want to share some of these disease risk stats just to show you that in puberty and premenopause, in your most fertile years, you have the lowest incidence of breast cancer, cardiovascular disease, dementia, broken hips. Heart disease and stroke increases from 1 in 7 to 1 in 3 after menopause. Osteoporosis, 1 in 3 women over the age of 60 will die within 1 year of a hip fracture. Alzheimer's, dementia, memory disorders, studies indicate that 85% are hormone related. Depression and anxiety, metabolic problems, diabetes and cholesterol, eye problems, urinary tract infections and incontinence, cancers, breast, colon, uterine, extremely common in perimenopause and menopause. And that is when your hormone levels are the absolute lowest. So please understand that there's more to the picture, because if all of those things were related to hormones, then why would all those things be highest when your hormones are the lowest? I don't want you to go this alone. What if you could feel like yourself again and you weren't living with chronic fatigue and discomfort, missing out on life, experiencing no sleep, wondering if relief is even possible, feeling frustrated, struggling with mood, feeling confused? You get it. And essentially just losing hope for restored energy and joy. I want you to live a vibrant life again, and customized hormone therapy is designed just for that. And you can get support from an experienced team of specialists, and it's so much more intensive than just BHRT. It's a support system. And without a system, you're doomed to fail. And even if you have a doctor who can prescribe BHRT, having that system of health and wellness and really understanding what's going on is everything. So, are you ready to make a real difference in your life? At Hormone Bliss, we're dedicated to helping you take control of your health and reclaim your vitality. Whether you're navigating the challenges of menopause, perimenopause, or just feeling off balance, we are here to guide you every step of the way. My personal mission and passion is simple: to empower you with the knowledge and support you need to feel like yourself again, strong, confident, and truly thriving. On the consultation that you're about to have, I want you to know that together we'll take a closer look at your symptoms, explore personalized options that could make all the difference. And I know that's going to be amazing. Our hormone advisors are so knowledgeable, and their only commitment is to you and you feeling better. I want to invite you to become a part of our program and all that we do and all of the offerings. There are so many things I can't even in this short video begin to tell you, and they're going to share all those with you. Everything from health hormone coaching, live monthly Zoom calls with me, full access to my Healthy Hormone Academy, 90-day supply of your bioidentical hormone creams are included, and it just goes on and on. But please find a quiet space, not the checkout line at the grocery store. This is about you and your health, and it's very, very, very important. Have your significant other, anyone who else has experienced the suffering that you've had, so they can really be in full support of your journey back to you. Be prepared with a notepad and a pen to ask all your questions, and know that every step of the way we got your back, and we are your sisters and your friends here at Hormone Bliss. Thank you for taking the time to watch this video. I love you very much, and I just want the best in your health and wellness for you.